Well, welcome to Pancreas School. I'm Dr. Doug Evans, and we're expanding Pancreas School to include all aspects of the research and treatment of pancreatic cancer. And today's episode concerns what happens after you have the operation. You go to the recovery room for a couple hours, and then you're admitted to our dedicated surgical oncology floor, which we're so proud of. We're most proud of the amazing people that will be caring for you on the 12th floor of Frederick Hospital, which is our dedicated surgical oncology floor. We're an amazing group of nurses, dietitians, physical and occupational therapists, and every member of the recovery team ensures a safe and rapid recovery from your pancreas operation. Enjoy today's episode of Pancreas School.
Hello, welcome to Pancreas School. My name is Bente Smith and I'm a PA at Surgical Oncology here at Medical College of Wisconsin and Frederick Hospital.
I'm Ricardo Bello. I'm one of the Surgical Oncology Fellows here at the Medical College of Wisconsin.
We're going to talk to you today about postoperative care after your pancreas surgery.
Many people have many questions about how they recover from their surgery, and this is something that we do with the help with many team members and the best that we have from science and also the experience of a high volume practice.
After your surgery here for pancreas surgery, you'll immediately go to the recovery unit, the PACU. The anesthesia team and the nursing team there will make sure that you recover safely and efficiently from your anesthesia. When they feel it's appropriate, they'll send you up to our floor, the surgical oncology floor, where you will stay for the remainder of your stay. While here you'll have several people who will be a part of your team. It will include residents, fellows, nurse practitioners, physician associates, dietitians, physical therapists, occupational therapists, pharmacists, you name it. There'll be a lot of people you'll see regularly throughout your stay, and our goal is all the same, to get you home safely and efficiently.
So our surgical oncology floor is a dedicated surgical oncology floor. It's at the top floor of the Center for Advanced Care, the Frederick Hospital. And my favorite part is the fact that we have the best nurses at taking care of our patients over here. They're very comfortable at taking care of our surgical patients, and they're also sometimes our non-surgical patients when they still get care for the pancreatic cancer at other stages of the treatment. Having this team set up is very important because we all have familiarity with the normal ways that we take care of our patients, and the fact that we have standardized most parts allow us to pivot and adapt the plan as needed depending on the clinical scenario that we're seeing. When you come up to the floor, most patients after their surgery will have 3 tubes in their body. One of them is the nasogastric tube, which is this tube. It's a little bit softer than the normal tube that people normally have, and it helps decompress your stomach. It is bothersome to have in your nose, and sometimes using either a lozenge or a throat spray helps alleviate that discomfort. The tube, however, is very important, but it keeps your stomach decompressed while you heal and your new connections heal from the surgery. This tube usually comes out either the second day or the third day after surgery. The other tube will be a urinary catheter or a Foley catheter. We keep this in place so we can monitor your fluid status and see if you need to have either more IV fluids, less IV fluids, or more diuretic in the initial stage of your postoperative stay. This tube also usually comes out on the second day after surgery, but it depends. It varies by person. The third tube will be a Jackson-Pratt or a JP drain, which is a tube that comes out of your abdomen, and it helps drain the fluid that's in your abdomen and give us an idea of what type of fluid that is. Ideally, this should look serosanguinous, which is a mixture in between serum and diluted blood. We monitor this drain and we take it out the first few days after surgery.
As mentioned before, you'll have several people that are a part of your team while you're here in the hospital. One of the important teams that will be following you is the diabetes management team. That includes a bunch of advanced practice providers and physicians, as well as diabetes nurse educators who will continue to follow you as you advance your diet and you increase your intake. Your blood sugars will change as you start to eat a little bit more, and they make daily changes to your insulin needs so that you know exactly what you'll be going home on. It's really important that you engage with them when they're in your room because they can give you really important feedback and education on how to manage your blood sugars at home. This is a new changing thing for a lot of people. It can feel overwhelming, but they are an excellent resource for you. It's important to feel comfortable while you're here in the hospital so that when you go home, you know how to manage it independently.
Our diabetes educators are often one of the key people in taking care of you it's very important that you feel comfortable with managing your own blood sugars when you go home. This is especially true for patients who require a total pancreatectomy to remove their tumor.
Just because you use insulin here in the hospital doesn't mean you need to use it when you go home or long term. But either way, it's important for you to know how to check your blood sugars and to kind of follow that closely so that we can intervene if we need anything.
The other aspect of the pancreatic function that we also look at after your surgery is the exocrine part, which is the enzymes that help in your digestion. So once you start on a thicker liquid, a full liquid diet after your surgery, or a regular diet, then we start you on pancreatic enzyme supplementation to help in your digestion and your absorption of nutrients.
Everyone is different with how many enzymes they need with what they eat. So it's hard for us to tell you when you go home how much you'll have to take. We'll continue to work with you while you're here, both with the dietitian and the pharmacist and our surgical team, so that you feel comfortable in adjusting it at home. It's something that you will have to adjust probably over the next course of several weeks or months. And people tell us that over time they get to a comfortable place so that they know how to manage it themselves.
Apart from pancreatic enzymes and insulin, the other very important medication that we do after a pancreatectomy of any sort will be a proton pump inhibitor or a gastric protectant of some sort. And this helps alleviate the amount of acid that's in your stomach, which is now in contact with a new anastomosis or a new connection with the small bowel. You will go home on this acid protectant, and then you'll be taking this then when you're home.
Probably a big question that everyone has following surgery is, how will they manage my pain? This will start immediately post-operatively. Originally, we'll use IV medication to control your pain. We'll have scheduled medication 24 hours around the clock, and you also have what we call patient-controlled analgesia, which is PCA. Truly just a little pump. You have a little push button that you can push every time you're feeling uncomfortable, so you have power and control over the situation. We will adjust those medications as needed and as frequently as you feel is necessary, so that you feel comfortable, that you can get up and move around, you can eat, you can ambulate, and you can do the things that you need to do to take care of yourself. As you transition to a regular diet, we'll start ordering oral medications and transitioning to the medication regimen that you'll be home on when you leave the hospital. We like to prioritize Tylenol because it gives a lot of anti-inflammatory aspects, and it's also something that you can take comfortably at home. We'll continue to give you some narcotic pain medication as needed. You can also have some additional adjunctive medications so that you can use it whenever you're feeling uncomfortable at home. Our goal is for you to feel like you can move independently and that pain isn't a limiting factor for you.
Your care in general needs really a village of people to take care of you. You'll have the nurses over here, our physician assistants, our physician associates, nurse practitioners, residents, fellows, and attending surgeons as well. We're all here to take care of you together with the diabetes management team and any other consulting teams that we might need to bring as part of the team. And the idea for us is have a well-coordinated team that communicates seamlessly with each other and with you, and that we keep you up to date with all the different events in your care. As we continue on your recovery in the hospital, and we plan for your recovery outside of the hospital, we'll have a plan set up for when you come back to see us in the outpatient clinic, and when you come back to see our diabetes doctors and the other doctors that you also have to see. It really takes a village to take a patient after a pancreatectomy and take good care of them, make sure that they're going to be safe, and we try to do this in the best coordinated way as we can.
It's also important to note that you will see a lot of team members throughout your stay, but there are a lot of conversations happening behind the scenes. You'll meet regularly with the diabetes team, the surgical oncology team, the nurses, but there's also a lot of conversations that we're having with other healthcare providers behind the scenes to make sure we're taking excellent care of you. One of these people is the pharmacist. We talk to them regularly about your home medications, about the medications that you're on while you're here in the hospital, and the medications that you will go home on. It's super important for us to have accurate information about medications you've been taking before surgery so that we can make appropriate decisions about what's necessary for you after surgery. Now, Dr. Bello had mentioned earlier that you'll go home on a couple of different new medications, and some of these things we can almost always anticipate. One of the things is an enzyme supplement or an enzyme replacement, which is something that we almost always use on our pancreas surgery patients. The acid suppression medication, and then also generally an anticoagulation or a blood thinner of some type. This decreases your risk of developing blood clots post-surgery. Depending on your personal risk factors and the surgery that you have, we'll make decisions about which medications you'll need and for how long. The pharmacist works with us very closely to determine the safety and efficacy of all these medications.
We'll also look into how these medications interact with the other medications that you take at home and with any other conditions that you might have. So we try to keep everything integrated together. Many people ask how long the recovery is after this surgery, and of course it depends on what we mean by recovery. Part of the surgery about being back on a regular diet usually takes about a week. For some patients it takes a little bit longer, and some patients require some IV nutrition, even either while in their hospital, while they're in the hospital, or when they go home, just to support their nutrition through this important time of healing in their body. Then when you go home, it will still be important to keep a very close eye on your hydration status, your nutritional status, because the recovery requires a lot of hard work, both on the part of the team, but also on the part of the patient. It takes several weeks for your energy levels to go back to normal and your appetite to go back to normal. These first several weeks are the time when we have to be most vigilant to make sure that you stay well when you go home.
As mentioned before, one of our goals is to get you home safely and efficiently. Now, that looks a little bit different for everyone. It's hard to say what you can anticipate. Our goal is to have you in the hospital 5 to 7 days. Obviously, taking into individual differences, that can be a little bit longer, a little bit shorter for you. The main thing is that you don't have to be 100% before you go home. However, we want you to feel like you can do the things that you need to do to take care of yourself independently. As Dr. Bello mentioned, we want to make sure that you can drink adequate water and eat, but we also want to make sure that you can get up out of bed, that you can shower, that you can go up the stairs in your house, you can get to the things that you need to do to take care of yourself. Most importantly, we want you to feel confident with your plan of care. We want to make sure that you understand the medications that you're taking and why you're taking them, when to call if you're concerned or if there's something that might be an issue, and we want to make sure that you have those resources to do so. When you leave here, I want to make you sure that you feel like you know what to do. I don't want you to go home and feel unsure of what the next step is.
And maybe finally, the most important thing we want to make sure is that you feel heard. And if you have any concerns, you please feel open with voicing your concerns with us. We do our best to keep the standardized care as seamlessly as possible and as customized and personalized to your current situation as possible. But sometimes we have to make some little tweaks and little changes that will depend on who you are and what you value the most. So we'll work with you, and we'll also work with the rest of the team to keep things as well coordinated as possible.
Absolutely. We're here to answer questions, concerns while you're here. And even if your team member isn't directly by your bedside, we absolutely are willing to come and chat with you and fill you in on information or decision making and make sure that you understand what the decision is.
We're looking forward to taking care of you when you come to Freighter and MCW for your surgery. We have a great team here. We're very proud of the team that we have assembled. And just please count on us as your team. If there's anything that we can do for you before you come here, when you're here or after, please don't hesitate to ask and voice your concerns.